All puppies are playful and want attention all the time. But not this golden retriever. He would just sit quietly beside the owner's blind father-in-law the whole day, his constant companion. The puppy would wait outside while her father-in-law went to the bathroom. You can imagine how happy the father-in-law was every day. He passed away and told the owner to take good care of him. Now, the golden retriever had this gigantic elbow lump. The owner wished to get it cut off. The other vets did all the tests, but did not want to operate. They asked the lady to do MRI imaging at another vet. Eventually, she came to Toa Payoh Vets and asked Dr. Singh, "Can you do the operation?" This is a Be Kind to Pets veterinary educational video brought to you by Toa Payoh Vets. This video has graphic content. Viewer discretion is advised. From the 7th of April to 30th of June, Singapore was undergoing its COVID-19 lockdown. Most shopping malls, like this Funan shopping mall, were closed for over 2 months in order to reduce community transmission. Deliveroo food riders were working harder than ever as more people stay at home to avoid COVID-19 infections. At the same time, Singapore was also undergoing its elections. This video is the second video in a two-part series on a golden retriever with a large elbow sarcoma. In the first part, we covered the diagnosis of the golden retriever after it came to Toa Payoh Vet with a large elbow lump. The lump had been growing progressively larger since March 2020, which is right before the COVID lockdown, and vets were unable to operate on the sarcoma. In this video, we will be covering the treatment and the post-op follow-up. Based on the histology report submitted by the previous vet, it was found that from the cutaneous mass on the left front leg, over 80% of the mass has undergone severe coagulative necrosis. The mass was also comprised of neoplastic mesenchymal cells, which are arranged haphazardly and are further supported by moderate fibrous connective tissue stroma. The individual cells have indistinct to vaguely distinct cell borders, are elongate to spindle, and contain a moderate amount of variably eosinophilic fibrillar cytoplasm. The nuclei are round to oval, contain finely stippled to coarse clump chromatin, and up to 2 prominent nuclei. Mitosis are frequent. There is moderate to marked anisocytosis and anisokaryosis characterized by karyomegalaic and binucleated forms. There is no normal tissue present. This led to the previous vet to conclude that the cutaneous mass consisted of poorly differentiated sarcoma. The only viable treatment option for the removal of the tumor would be surgical excision, and this was performed by Dr. Daniel. The elbow mass excised was more than 2 kilograms in weight and clearly resulted in a lot of blood loss for the golden retriever. A day after the operation, the dog was eating well and wanting to pee and poop. The dog is looking well for the 8 hours post-operation. On the 4th day after the operation, the wound had opened up and started bleeding. The dog was brought back to the clinic. The wound was cleaned and its bandages were changed. Antibiotic powder was used to prevent a bacterial infection from occurring. On the 10th day after the operation, Dr. Singh managed to follow up with the owner and found out that the wound was kept clean daily. The bandage was also changed every 2 days by the owner. The golden retriever is confined to his cage most of the time.
Sobi.
This is 2 months after the surgery. As you can see, the golden retriever looks very alert. However, its elbow sarcoma had unfortunately grown larger once again. Its cells turned dark red and the skin surface broke. The golden retriever was in great pain as he snapped at the owner who tried to clean his wound. The dog was restless and was unable to walk. With all family members around on a rainy afternoon, the owner requested euthanasia on Saturday, the 12th of September 2020. In conclusion, amputation was raised as a possible treatment option by Dr. Singh to prevent spread of cancer to the other parts of the body. Secondly, hygromas are common, but not every lump near the elbow is a hygroma. Finally, for any lump, biopsy, fine needle aspiration, and cytology are still the best practice.